Hello, David Sweeney here. Thank you for your interest in Dublin 2 Chiropractic. We're located here on Mount Street Upper, and that's just off the beautiful Marion Square. In this video, I want to explain what chiropractic is and if it can help your condition. First of all, what is chiropractic? Well, as a chiropractor, it's my job to assess all of the joints within the spinal column and pelvis and make sure that they work really well. So the spine is made of 24 separate bones, 7 in the neck, 12 in the middle back, and 5 in the lower back. They rest upon a foundation called the pelvis. In the middle we have the tailbone, which is a rectangular bone, and either side we have larger wing-like bones called the ilium. In between each of these 24 bones we have a disc, which is the cartilage and allows the movement. And we also have a paired nerve that comes out of every single segment, and that supplies our nerve function to the rest of the body. So the spine has 3 functions primarily. Number 1, it adds structure to our body. So that's what dictates our posture. So if we've got a really healthy, good spine, most of the time we're going to have a better posture. Number 2, it allows great flexibility and movement of the trunk and the neck. And then of course number 3, the bones are actually armor for the delicate spinal cord. The spinal cord is actually inside of your spine. So what problems can the spine develop? Well, the joints themselves can start to fail to move properly. We call that a restriction of motion or a misalignment. And basically, instead of the bones having free movement, they can get locked down in place and become very tight and constricted. Each joint should be able to rotate side to side, move inside lateral flexion movement, which is a side bending movement, and also have a back and forward function as well. The problem occurs when maybe we have a poor posture for many years. We call that a chronic condition, so it builds up slowly over time. Or maybe we've been in a car accident, we get a sudden hard impact and insult, creating blockage and restricted and abnormal function within the joint. So it's the chiropractor's job to palpate through the spine and identify key areas within the spine that are failing to move correctly and restore these key areas with an adjustment. Another way that you can think about a restricted movement within the joints of the spine is imagine a hinge on a door begins to slowly become rusted. Over time, the movement of the door becomes limited and begins to fail functioning properly. And if left unchecked, that can lead to inflammation, muscular spasm around the spine, and also pressure on the delicate nerves coming out and supplying the rest of the body. So injury to the spine can cause restriction and blockage of movement that over time begins to tighten. And that compression causes inflammation, muscular spasm, and nerve pressure. So if your brain is trying to coordinate and run all of the organs and systems of your body, your sensation, your muscle strength, it's understandable that nerve compression isn't a great thing for your spine and your body. One other factor is that compression and restriction of movement leads to abnormal compensations within the spine itself, and unfortunately that can actually accelerate the wear and tear process within the spinal column. And this is certainly something that we wish to avoid, and chiropractors, we're adjusting and manipulating the spine to try to reduce the level of degenerative change that takes place in our patients over their lives. So when you come into the clinic as a new patient, what we need to assess is really, first of all, the case history, determine your story and what's happened in your life so far and where the symptoms come from and how severe it is. That will really help us that will dictate where the examination goes. But for many people, when we move on to the examination, it's a comprehensive approach because we need to assess every component of the body to make sure that we don't have areas affecting other areas, so nothing's really missed. So the examination consists of postural check, range of motion, orthopedic, neurological tests, muscle palpation and also palpation of the spine. Now, as a chiropractor, primarily it's my job to make sure the spine is working really well. So between each bone we have a joint, and those joints really need to move well in rotation, in side bending, and kind of back and forth, so a shearing movement. And the reason why we look for that is because the chiropractic adjustment is what fixes that functional problem. And this is really important because if a joint and bone doesn't move well, it leads to other areas starting to compensate and create pain, problems, inflammation, muscular spasm. So this is the clip of the adjustment. The adjustment, as we can see, starts in the middle part of the spine, and after palpating, I've identified an area that needs to be adjusted, and I can use my body weight and my arms and deliver a quick, sharp push and move that. For the lower back, it's done on the side position, as we can see here. And for the pelvis, it's also in the side position, as seen here also. The cervical neck adjustment is done with the patient lying on the back. So to finish off the video, you might wonder, well, can chiropractic help my condition? And the answer to that is, I don't really know until I get in and check and do the examination for you. So that's the most important part of this, is the examination, and trying to work out if the findings in the examination match up to your symptom. If it's neck pain, back pain, middle back pain, maybe rib irritation, chest irritation, jaw pain, headaches. I've also treated knee pain, hip pain, ankle, wrist, elbow, everything really in regards to the skeletal, musculoskeletal side of things in the body. A little bit about myself to finish up. So I've been a chiropractor in Dublin since 2010. I studied in the Welsh Institute of Chiropractic, and when I graduated I moved straight to Dublin and started in practice. I opened Dublin 2 Chiropractic in 2013. And since then I've been able to see a whole host of different conditions and problems. So yeah, I'm just coming up now basically to my 10-year anniversary of being a chiropractor, and super excited about that, and it's just gone like that. I can't believe it, from 2010 to 2020. It's mind-blowing. So thank you for watching the video, and if you have any questions or queries, please email or call. I'd be happy to talk you through any other concerns. Thank you.